Hello, good morning, good afternoon, and good evening again. Thank you for following me on my channel. Again, this is Dr. Dennis Latuno, and today we're going to be talking about tardive dyskinesia. I know a lot of you are surprised about this condition. It's rare, but it happens. So, what is tardive dyskinesia? It is a medication-induced hyperkinetic movement caused by antipsychotic medication, usually both first and second generation, but the second generation has less incidence of tardive dyskinesia. And number two is the antiemetic medication like metoclopropamide, which is Reglan, and prochlorperazine, which is Compasine. When you say antipsychotic medication, it is used for schizophrenia, bipolar disorder, and other brain conditions. So, the dopamine receptor blocking medications or dopamine antagonists are most likely to cause tardive dyskinesia. Nerve cells, neurons in your nervous system make dopamine. This chemical neurotransmitter that it means it sends messages to dopamine receptors, which are proteins in your brain and nerves. The two work together to send nerve signals that control body movements. Chemical changes in your brain may make some people more sensitive to dopamine. So this high sensitivity causes nerves to trigger exaggerated involuntary movements. So tardive dyskinesia can affect all ages, genders, races, and ethnicity, but more common in older people, black or female. Drugs that can cause tardive dyskinesia, I told you, the antipsychotics, and these are the examples of the antipsychotic. The first generations are the Toracin, the Prolixin, the Haldol, also known as haloperidol, trilafone, and Navane and Loxetine. Diagnosis, tardive dyskinesia is hard to diagnose because symptoms may not appear until months or years after you start taking the antipsychotic medication, but usually it happens in 1 to 6 months. But you might not notice the movements after you already stopped taking the medication. Symptoms of tardive dyskinesia, early signs usually are not noticeable, like lip smacking or sucking motion with the mouth, tongue protrusion, grimacing or frowning, and rapid eye movement or blinking, rapid eye blinking, jerky body movements, swaying from side to side, chewing movement, twisting, spreading, piano playing, finger movements, tapping of the foot, and shoulder shrugging. These signs can be intermittent, infrequent, and then later on becomes constant. Complications of tardive dyskinesia Usually people with this condition become depressed or isolated, and it can affect their ability to work. It strains their relationship with their loved ones, and about 3% develop severe symptoms that can affect their quality of life, which includes breathing issue, dental problem, difficulty swallowing, and sometimes irreversible facial changes like facial drooping of the eyelids or mouth, and speech difficulty. If you have any of these abnormal movements and you're on these medications that I mentioned, you should call your primary care provider or healthcare provider, and so that they'll know that you're having these issues. The next slide is actually a video of a patient with tardive dyskinesia. And this is courtesy of Ostado. It's short, but it shows you how it looks like. So, clinical course of tardive dyskinesia usually are insidious, difficult to recognize because the movement can be subtle and fluctuating. And as I told you earlier, TD may appear as early as 1 to 6 months following taking the medication, and you increase your risk with cumulative exposure to the medication. How long do tardive dyskinesia symptoms last? Typically, tardive dyskinesia goes away or lessen when you stop taking a medication or lowering the dose. But some people will have a persistent symptom even if the medication is stopped. Treatment and prevention. As a patient, you'll need a regular checkup and screening for TD. And usually the provider will use the AIMS test. Offending drugs should be stopped whenever possible, but for patients with psychiatric condition, you either lower the dose or switch to a newer generation of antipsychotic. And then lastly, if the patient already had like a moderate to severe tardive dyskinesia and most likely already constant symptoms, you will need another medication to treat this condition to counteract the movements, and these are the VMAT2 inhibitors. Example of these are the valbenazine, which is also known as Ingreza, deutetrabenazine, also known as Ostado, and tetrabenazine, senazine. And then lastly, if everything else fail, last resort would be a deep brain stimulation. All right, that's it, folks. Thank you very much for watching my channel. This is a short video about tardive dyskinesia. Thank you again to my Filipino friends, especially the OFW all over the world. Thank you very much for watching my channel. Again, don't forget to subscribe and like and share. Again, Dr. Dennis Latuno, and see you later. God bless.